How would you manage hyponatremia? Salt, normal saline, hypertonic saline. In everyone, every time. Urea tablets, Vaptins, or diuretics. Let's dig into it. Firstly, let's look at the symptoms. Mild symptoms include headache, nausea. Moderate symptoms include altered sensorium, disorientation, and severe symptoms include vomiting, coma, and seizures. Secondly, let's divide hyponatremia into two parts: acute and chronic. Acute refers to onset of less than 48 hours, and chronic refers to the onset of more than 48 hours or onset of unknown duration. Now, coming to the treatment of acute hyponatremia, it is usually symptomatic even if the sodium levels drop just below 130. For the treatment, you give 100 ml of 3% NaCl, that is hypertonic saline, over 10 minutes intravenously, and this can be repeated up to 3 times in every half an hour, and the target sodium levels is 130. Coming to chronic hyponatremia, if it is severely symptomatic, then you proceed as per acute symptomatic hyponatremia. If it is moderately symptomatic, then you check the serum sodium levels. If they are less than equal to 120, you give 3% NaCl. Calculation will be given in the next reel. If it is more than 120, then you have 4 options: Vaptins, fluid restriction up to 800 ml per day, urea tablets, and salt with furosemide. So you check the volume status. If the patient is hypovolemic, then you proceed with isotonic saline or even oral NaCl. If he or she is euvolemic, then you proceed with Vaptins along with limited use of hypertonic saline. If the patient is hypervolemic, then you use Vaptins with fluid restriction. Now, if the patient is minimally or mildly symptomatic, then you prefer fluid restriction, that is up to 800 ml per day. And Vaptins are considered only if the patient is unable to tolerate the fluid restriction, or the sodium levels fall below 120, or the patient is in ICU, or he has unstable gait or high risk of fracture, or you want to give a therapeutic trial of 3% NaCl. Thank you.